Now we have great pleasure in introducing Kate Hurley back to present some more valuable information, this time on a broad overview of managing or developing standards of care in shelters and pounds. Thank you very much.
Thanks. Well, that was a whirlwind presentation. Very impressive. Nicely done. And a great segue into this final topic, and I know it's been a long day, but this is really sort of the big picture of doing what we need to do to keep shelter animals well. So I'm going to be talking about the Association of Shelter Veterinarians guidelines for standards of care in animal shelters. And those, I believe, are available on your CD or at sheltervet.org. How many of you have heard about the guidelines? Some. So this is something that the Association of Shelter Veterinarians, which is mostly a group in the United States, but we actually have an international membership of over 750 people, has been working on over more than the last 3 years, and just finally released those in December of 2010. I can say I'm excited about cat flu, and I'm even more excited about these. So something that we've been kicking around, I think, as a profession for as long as I've been in sheltering, which is a little bit over 20 years. And finally, the time is right. And I think there's various reasons. We have new resources. So we know much more about what shelter animals really need and what kind of interventions are beneficial and not harmful than we knew 10 or 20 years ago. We also have different expectations for shelters, certainly very different expectations. From when I started working in shelters 20 years ago, we have the rise of the no-kill movement, and we also have concurrently and sometimes seemingly contradictorily an expectation for an increased quality of care, and I'll talk a little bit more about that. Certainly in the United States, we have an increasing variety of providers of homeless animal care, and in some ways that's been a very beneficial thing. So care for homeless animals has expanded from something that just happens in animal shelters to more of a community safety net. So certainly when I started working, there was maybe one golden retriever rescue group, and if any kind of blondish dog could be disguised as a golden retriever, we could get it out. And now there's, in many communities, there's dozens or more rescue groups working with all manner of animals, with sick animals and with mixed breeds and with neonates and geriatric animals. And in many ways, that's very positive, but it also means that people with very different skill levels and very different goals are involved. And the actions of each one not only impact the animals in their care, but also impact on the overall perception of the animal sheltering profession. In the United States, there's increasing regulation of animal shelters, so almost half the states in the U.S. have regulations. But the regulations are pretty sporadic. They're patchy. It's sort of capricious what they address. And in some cases, some of what they address is good, but some of what they address is just sort of left out really important things. And in some cases, when the regulations are developed by people without a deep base of knowledge and experience in animal sheltering, regulations can have unintended, really harmful consequences. And so we felt like it would be best for us to be proactive and create what could be a foundation for regulations that we felt like would be beneficial and not harmful for shelters and shelter animals. And finally, we have negative events, and some of them are dramatic, and I'll share a few of those with you, but also just the everyday negative events that I think many of us kind of have accepted as the norm. The previous speaker mentioned, it's been going on for a long time, and it's hard to change that. And I think it sometimes takes stepping back and looking with sort of new eyes to say, well, what really is acceptable? If we never say that, we're not likely to ever get there. So this is just a little bit of the research that's come out in the last 10 years specific to animal sheltering, and it spans everything from what makes people more likely to adopt an animal to where animals are coming from that are entering shelters, to strategies for management of specific infectious disease and behavioral conditions in animal shelters. And it would really be a shame if we didn't incorporate that into what we're doing in shelters every day. And we also have changing expectations. So this spans even a little bit before I got into animal sheltering, the number of shelter deaths per 1,000 people in the United States. And that's a dramatic improvement, almost a tenth of what it was just 40 years ago. So from 115 shelter deaths per 1,000 to just over 12. And in some communities, under 2 deaths per 1,000. If we could get the whole world to under 2 deaths per 1,000, would that be good enough? No. Why? Because it matters how they live, right? It doesn't just matter that they're alive. So this was a newspaper article that came out the day before I was giving this talk in a little town in Ohio, and it happened to be a hoarding case in a town in Ohio. A horrifying discovery at a no-kill rescue. Dogs were being housed among rat, feces, and urine. The conditions were so dire that the Clark County Department declared the property to be a public health nuisance, and hundreds of dogs, over 350 dogs, were rescued out of a pig barn where dogs had been kept in darkness in crates where they couldn't even jump up, sometimes for years at a time. And from the organization's website, it's our goal to not have another dog put to sleep for problems that can be treated and worked out. Euthanization should never be a solution to the problem, only a last choice. So why do I have a little happy face by that changing expectations? This was not in a sheltering journal. This was just in a local newspaper. And here's what they wrote. Obtaining death row dogs from area shelters only to house them in unsanitary conditions is not a solution. Successful organizations must move incoming dogs out to responsible foster homes or to adoptive homes. The number of dogs being cared for must be manageable. Living for days, weeks, months, or more in a deplorable environment only victimizes these homeless dogs even more. There's more to no kill than being alive. There's more to being alive than simply breathing. So I think it's a great thing that we now have the expectation both of not killing animals and of taking good care of them. And when I did the shelter medicine residency 10 years ago, I actually thought that sometimes there might have to be a trade-off, that we might have to choose between saving a lot of animals' lives or taking really good care of animals. And in that case, it's hard to balance. And what I've really come to believe is that, in fact, there's synergy between taking good care of animals and saving the most possible lives. That, in fact, the cheapest way to take care of animals is to take them in, keep them healthy and well, and find them good homes rapidly. So I think not only are the shelter guidelines for standards of care important for providing quality of life for shelter animals, I think it's an important tool to help you sort of stay on target as you progress also towards reducing euthanasia of otherwise adoptable animals. So this is our increasing variety of providers. There's over 14,000 rescue groups posting animals on our most frequently used adoption website. I don't know if you have something like this. I looked around for Pet Finder Australia. Do you have something? So you can kind of keep track of how many organizations are involved with this, and it ranges from one person to very large organizations with multiple shelters. Over 300,000 animals were in the care of these 14,000 organizations, so a lot of lives hanging in the balance on any given day. And this was just when I typed into Google, animal shelter, hoarding, rescue, fiasco. And that's just from probably less than a year, the headlines that I was able to run across. And you can see that these span every kind of organization. So King County Animal Services, so that's what you would call a pound, a government-run organization, or Memphis City Animal Shelter. Deputy rescues scores of dogs from private shelter. Tiger Ranch owner faces trial on 593 counts of animal cruelty. Starving dogs rescued from pet adoption center. Over 100 dogs. Nonprofit animal rescue and hoarding case. So these are big, well-regarded shelters. These are small organizations, these are individuals, these are no-kill, these are open intake. It's every kind of shelter that can get overwhelmed and can cross the line into providing poor care. And in some cases, our hands are tied. In some cases, this is the same organization that prosecutes animal cruelty that is potentially committing animal cruelty. And in some cases, if you just take in thousands of animals and you keep them in conditions that don't really permit a reasonable expectation that they'll be able to maintain their health, it's not illegal. If you put them in a filthy cage and you don't vaccinate them, if you put them with other animals where they might have to fight for something to eat, it doesn't cross the line into animal cruelty in many areas of the world. And this is just one case study, Toronto Humane Society. And a quote from the paper. So the Humane Society was raided by the other animal protection organization in that area. The way this shelter's been run, it's absolutely disease-infested. Animals are left to catch horrible diseases, die in their crates based on the euthanasia policy. These are animals who are just left to die. They're found a dozen at a time, dead in cages every morning, dying from cancer, suffocating on phlegm, animals who are starving to death, literally. And I wish that that was just one. I've been to many shelters, including many well-regarded shelters, where the conditions were like that. And oftentimes the staff had sort of become so accustomed to the conditions that they weren't even aware of what was happening around them, and they still believed themselves to be a really good organization. And when changes were made and conditions were improved, I've had people come up to me crying afterwards and say, we had no idea it could look like this, it could smell like this, that it could be clean, that the animals could be quiet. We just didn't know anymore. These are not bad people, for the most part. These are passionate people who are trying to do the right thing. And here in another article, it talks about a leader with a passion for the animals, loyal supporters, and an iron grip. So they were applauded for success in lowering the shelter's euthanasia rates. And I'll show you a slide that shows that was real. There was real progress being made in that regard. But there was sort of a casual attitude towards deteriorating conditions. So the director said, if you put cage on top of cage, as long as the animal's living, isn't that the whole thing? You can't let interior decorating get in the way. And here is the data from the shelter at that time. So pretty good, an intake of over 12,000 animals and over just under 1,000 euthanized. So that's less than 10% euthanasia rate. Now there was another open-door shelter in that community as well. So there's more to that picture, but also look at that. Almost 2,000 animals died in the shelter's care. So there was a reduction in euthanasia, but an increase in shelter death. And if you look at the cat numbers, over 10% of the cats died in the shelter's care. All charges were dropped. And the Crown, this was in Canada, acknowledged problems that the director was controlling and dominating. Staff had to check before conducting euthanizations. The shelter was overcrowded, but that treatment, cleaning, feedings, and appropriate decisions to euthanize were often delayed. There have been shortages of medications. However, when they actually visited, cages were clean, ventilation was adequate, and animals were being fed. And it would have made it difficult for the Crown to prove beyond a reasonable doubt that senior officers willfully permitted animal suffering by failing to exercise reasonable care. So you can go to a place where almost 2,000 animals have died in the shelter's care, but if on the day you go there, animals are fed and cages are clean, there may not be anything that can be done. And I'll tell you now, I'll show you pictures much better now, in spite of charges having been dropped. Now I'm just going to show a few images these aren't headline news. These are things that are happening at shelters, often that are very good shelters, where great things are happening in the community, where people are trying hard, where improvements are being steadily made, and yet there's problems with maintaining the health and reasonable well-being of the animals. This was a shelter we visited where dogs were just being chased onto the other side of the run with a squeegee because the guillotine doors were broken between the two sides of the run. So there just was a lack of maintenance of the facility. And at another shelter where cats were kept in small box cages and they just escaped kind of routinely during cleaning. And when that kind of rodeo happens, there's just not a reasonable expectation that the cats can be maintained in a way that's free of real severe stress. The shelter lot of cute dogs. You can see that the runs were supposed to be separated by a guillotine door, so each dog was supposed to have two sides of a run, but they'd gotten overcrowded, and so the guillotine doors were down and there was a dog on either side, and there wasn't enough staff to take each dog out individually so that they could clean the runs, and so they just let the dogs all out into a common area during cleaning. There was a cute dog that we were wanting to take home with us, and we saw it out there the same time that this hound dog was blowing out with bloody diarrhea. And so all that cute group of dogs was exposed to this one dog with bloody diarrhea early in their shelter stay before vaccination could protect. So with that housing system of dogs having to be commingled during cleaning, there was not a reasonable expectation that health could be maintained. And this is just, again, guillotine doors. Actually, the shelter was designed without back doors to the runs, so they had to hose from the front. And again, not sufficient staff to take the dogs out, so they were being hosed in the runs. And this, really a very common sight. It's just single dog runs, so that dogs have to be removed on a daily basis for cleaning. And this is a puppy who can't be fully protected by vaccination. And so you can see from the wet paw prints that he is being walked across an area where a lot of other dogs have walked. And if there's parvo in that run, he's very likely to get parvovirus. So the whole setup of the shelter building doesn't really allow maintaining all the animals' health. Who can see anything wrong with that cage setup? It's awfully small, and someone's going. And one of the dimensions in which it's small is that it's just short, and the cat can't lift its tail up. And we don't know really what impact that has on welfare, but imagine if we were staying at the hotel where they just put the ceiling a little lower than your head. Holding a tail up is a point of pride for cats, and it may be that it's really unpleasant for them to not be able to just lift their tail or to stand up and stretch and assume what's a fairly normal posture for a cat to assume. So one of the shelter standards is that cats must have a cage that allows them to assume all normal postures, including holding their tail fully extended above their head. Just that distance. Can you see anything wrong with that setup? It's a little bit bigger. It's really tall enough for her to hold her little tail over her head. She's got a bed. She's got a toy. It's just a bad crop job. It's not on a slope. Anything you want to know about that setup before you can say it's fine? Yeah. And what if I told you she's been there for 13 months? So the guidelines say that alternatives to traditional cage housing must be provided for animals in long-term care. And we know that, but it's helpful to have someone say that so that we can have the impetus to really make it happen when resources are scarce. Some of you saw this on Tuesday at my presentation. This is a litter box. This is a turd. This is a bowl of food. Does that cat have access to food and clean water? No. This really adorable pit bull with a giant noggin, not the most popular breed in America, not the dog that has the easiest time getting out of a shelter. And because he's in a single run with guillotine door closed because the shelter was overcrowded, he's had to poop on his bed. So he's there practicing the behavior of soiling his eating and sleeping area. Is that going to help him get out the door? No. Is that going to help him maintain his well-being if he's a dog who has a drive to defecate away from his eating and sleeping area? No. Bad shelter? No. But needs to be more of an acknowledgement that these are problems that we need to solve. Any of you dealing with shelters where some of the housing, the walls look like that? Hopefully not. Those are just cages that can't be cleaned. Realistically, they can't be disinfected. And we happen to be doing a titer study, so we know that this puppy came in without antibodies to parvovirus or distemper, both of which were endemic in that community, and that puppy was housed in that cage for several hours before being vaccinated. So very likely he was exposed to a fatal illness on entry to the shelter. So just housing that can be effectively disinfected. The left-hand picture is actually a movie. I wonder if you can run that from the back there. If you hover the mouse over it, it should activate a little clicker in the lower left-hand corner. Maybe not. No movies for you today. Maybe if you just look at the picture. Can you see the dynamic there around the food dishes? Can you see the various stare downs that are happening? And if you watch this play out, this was not a shelter where they were actually showing this as a point of pride because this was their new group housing area. This is their alternative to traditional cage housing. But it was just overfull of cats. And so there was not one relaxed cat in there. And the cats that were guarding the food weren't really having a chance to eat, and the cats that the food was being guarded from weren't having a chance to eat. And some cats were just staying up in perches and not even getting involved. And this was also in some small group housing where the monitoring just wasn't sufficient to make sure that the cats were getting along. And so that black cat, every time that gray cat looked away, he put his hand in his bed. And then every time the gray cat looked back, he pulled his hand out. Which was definitely enrichment for the black cat, but sort of horrible for the gray cat. And maybe didn't put him in the best state of mind to put his best paw forward when someone came looking to adopt. And again, these are movies, so I'll just move past that. These are just co-housed animals where one animal in the run was not being able to eat because of other animals in the run, even though more bowls of food were being placed than there were animals in the run. But just when monitoring is not adequate, when staff doesn't have time to just stand there and make sure that the animals eat, then sometimes not all animals eat, even though you're providing them with fresh food and clean water. And then not headline news, but when 30% of cats are ending up with respiratory disease, and when 30% of euthanasia reflects cats getting ill with this condition, again, we're not maintaining the health of a big chunk of our animals. That's all kind of depressing. So this was our response, our attempt to address it. We feel like we're at a point, both as a profession and as a science, where we can do better. It's the author's greatest hope that this document will serve shelter animals and those who care for them by providing scientific and humane guidelines for their care, recognizing that people who care for shelter animals don't want to provide substandard care. And we really wanted to acknowledge, this is my dog, Moggs, at the Fort Collins Hilton in Colorado. He loves hotels, especially hotels where dogs aren't allowed. But our point is, humane care is not window dressing, and we're not asking for the Hilton. We're asking just for the basics, just enough to keep animals safe from harm and free of fear. So we have quite a few different authors, and really from a wide variety of backgrounds. So the term pound in the United States is a total dirty word, so I've been trained not to say it. But people from government-run shelters, people from nonprofit private shelters, people from open intake and no-kill shelters, and people working on a state, national, and academic level. And we also came from a lot of different backgrounds. So we were all veterinarians at the time of writing the document, but many of us had held other roles in shelters as well. So we'd been foster parents, we'd been volunteers, we'd been kennel attendants, adoption counselors, animal control officers, and shelter directors. Between us, we brought well over 100 years of experience to the document. And we felt it was appropriate that veterinarians would be the ones to bring sort of a scientific perspective to providing guidelines for standards of care. And the first thing we did when we started out a little over 3 years ago was to do an exhaustive and exhausting review of existing standards and guidelines for other confined animal populations. We looked internationally for standards for boarding canneries, for kennels, for sanctuaries, for zoos, for laboratory animals. And we tried to step away from the notion that shelters somehow got a pass because we're doing this for the right reasons. And we thought, if it's not good enough for a laboratory cat, it's not good enough for a shelter cat. And we actually paid a series of students to read through all of those standards and then pull all of the scientific literature that those standards were based on, and then we read it all and saw whether it really supported the recommendation that was being made or not. So wherever possible in the guidelines for standards of care, we've provided scientific recommendations. Where it's not been possible, where there just is no science, we've acknowledged that and acknowledged that it's the author's experience or it's just our expectation that this can't be provided without X, Y, or Z standard. And we intended it to be both a carrot and a stick, both a hammer from the outside and a tool that shelters can use. So explicitly, it applies to any organization caring for homeless companion animals, and we felt like that was really important. Whether it's a formal shelter with a big building, or it's a foster home, or it's a loose network of rescue individuals, a sanctuary that cares for animals for life, or even a group that's just involved with transport of animals. And we intended it to be a tool to advocate for animal care and well-being from within shelters. And we've seen it used to go to funding organizations to say, hey, we need the money for vaccines because it's a standard of care in animal shelters. Or we need to have bigger cages because that is now the expectation. That's the basic standard of care. Or from without. So when there's concern in a community that a shelter isn't meeting appropriate standards of care, to give some guidance also in that situation. Are you all familiar with the 5 freedoms? So these were developed quite some time ago in a context of food animals. But we felt like they were broad enough to really provide a target for us to work with. And so that's the foundation of the guidelines for standards of care. And I think we wouldn't argue that this is too much to ask, that this is window dressing. Freedom from hunger and thirst. And I showed you some examples where that really is an issue, even in otherwise pretty well-run shelters, just because of the setup of cages and the number of animals present or the lack of monitoring. Freedom from discomfort. It's not going to be for every minute that an animal is in our care. There's going to be some discomfort. But providing conditions that at least permit the possibility of comfort for much of the time that the animal is in our care. And the same with freedom from pain, injury, or disease. We aren't going to be able to prevent it all, but to provide conditions that are conducive to preventing illness and maintaining health. Freedom to express normal behavior. And this really goes to the previous talk. I think if any of us in this room would pick one freedom to keep, it would be that one. Most of us, and I think it's the one that we think about the least, but most of us would tolerate some risk of disease. We'd get out and mingle, even if we know we might get the flu from someone. We take risks. We drive in cars. We fly on airplanes. We ski. We do stuff, even though we know there's a risk of injury, because not expressing normal behavior is agony. The most serious torture that we can inflict on a human being is to put them in solitary confinement and prevent the expression of normal behavior, even if you're not in pain and you're not sick. So we need to really be cognizant of meeting that freedom. And then freedom from fear and distress. So this is the table of contents. We really made it pretty broad to cover what we felt like were all the different aspects of sheltering that are impacted by the 5 freedoms and that contribute to whether the 5 freedoms are met or not. So operations, facility design, population management, sanitation, medical health, behavioral health. We made group housing its own little thing because it had some components of behavioral health and some components of facility and some components of medical health. Animal handling, euthanasia, spay-neuter, animal transport, and public health. And the guidelines recommend outcomes rather than means to achieve those outcomes. So it's not an operational document that says, here's, you got to use this chemical to clean, and you got to use this kind of material for housing, and you got to enrich your dogs this way this many times a day. It gives an overall goal that needs to be achieved that could be achieved in several different ways. So here's one. Protocols must be developed and documented in sufficient detail to achieve and maintain the standards described in this document. And for some organizations, that might be a 500-page book. For some organizations that are small, that might be primarily word of mouth with a couple of laminated signs and a little handout. So however it's done, whether it's done through interpretive dance or through a PowerPoint that's recorded that everyone has to watch, as long as it's sufficient to achieve and maintain the standards described in this document, then in whatever way you do it is fine. And we divided it into several categories of unacceptable, which are things that really got to change right away because they're seriously putting the animals in jeopardy or, making it impossible to meet the 5 freedoms. Must, really needs to happen. Should, that's important. Should work towards that, if at all possible. And then ideally, and that's sort of the frosting. We know that that would be good. We know that you're not going to all be able to get there right away. That's an ivory tower, by the way. I didn't mean it to be an ivory tower document. So this is just a few examples of unacceptable. So what we defined unacceptable as is no sheltering organization, regardless of its circumstances, budget, size, etc., should engage in any practice that is deemed unacceptable. Cages or crates intended for short-term temporary confinement or travel, such as airline crates, transport carriers, cages or crates designed to restrict mobility during a defined treatment period for recovery, or small stainless steel cages less than 2 by 2 feet are unacceptable as primary enclosures and are cruel if used as such. So that's an example of unacceptable. You can believe if it's in there, people have done it. And here's a cat being housed long-term in a transport carrier, and there's its water, and there's its food, and there's its litter, and there's the cat. And the shelter's reasoning is that they were all full, and they needed more housing area, and so they started housing cats in transport carriers. And so that shelter needed a tool and a wake-up call to stop doing that. That was not serving whatever purpose they were trying to serve. Must. When a practice is identified as a must, it is believed that without adherence to this recommendation, the delivery of a minimum level of acceptable or humane care is not possible. Cats must have places to hide. Can be a paper bag, can be a towel, can be a bed, can be a corner, but they must have places to hide to have a reasonable opportunity to be free of fear and distress. Should and should not implies a strong recommendation. Group housing of non-litter mates should be avoided. We know it's not always possible right away, but it really does put kittens or puppies' health at risk to mix litters with one another, and it should not be done. Alternatives should be found to that. If that takes a little time, that's fine. And then we have ideally. It may not be possible in all circumstances, but would certainly enhance care for animals. Protected indoor-outdoor access is ideal for most species, especially when animals are held long-term. So maybe it can't be done, maybe it's not appropriate in every climate, but it's helpful in most circumstances, and ideally it would be done. It's a 70-page document, so it's kind of long. And this is something that a veterinarian that I know worked with her shelter to do, where she took all the different pieces of it, all the shoulds and the musts and the ideallys and the unacceptable, and she put them into an Excel spreadsheet, and for all the ones that her shelter wasn't doing. And then they noted which category it was in, and then they made themselves a little priority list. So let's fix this one first. And they prioritized the ones that were musts and unacceptables, but they also prioritized the ones they could do pretty much for free. So if it just required a little bit of staff training or posting instructions somewhere or just changing how they did something a little bit, then why not make that change? And so they could actually have some triumphs and pick those things off. And then the things that were longer term, even if they were really important, they were going to do a little bit later. We're working on a full Excel spreadsheet. I hoped to have it done by today, but there was a little computer glitch, but I think we'll have it done in the next week or two. So if you would like to have the Excel spreadsheet so you can just go through and check off, yes, we're doing that, no, we're not doing it, and end up with a list of the things that you're not doing, and then you can evaluate for yourselves whether you think they're appropriate for your organization and where they fall on your priority list and what it would take to implement them. Let me know and I can send that around. So we've had these for quite a long time, right? standards of care for different circumstances. It's not a new idea. Partly we lacked the knowledge, but the things I showed, the shelters, they knew that that wasn't great. Why was that still happening? Why do we let things go on at shelters even though we know they're not so great? Because we're mean and we hate animals? No. Why? Why do we have 2 dogs in a run where one isn't getting to eat? Why do we have a cat in a cage where it can't lift its little tail up? Because right now, we don't have another choice, right? We could provide great care for one animal. Probably all of us could provide great care for any one animal. But we have a number of animals that has exceeded our ability to provide great care for each one at a lot of shelters. So this is really the mother of all standards. Every sheltering organization has a maximum capacity for care, and the population in their care must not exceed that level. Many factors can alter the capacity for care. Foster care can alter the capacity for care for the better. Loss of animal care staff or malfunctioning enclosures can temporarily decrease the capacity for care until such time as new persons are hired, appropriately trained, or enclosures are repaired or replaced. Even though enclosures may be available, it may be necessary to leave some empty due to other constraints on capacity for care. And organizations must have a clearly defined mission. Policies must provide a means of balancing admission with the outcomes available, such as adoption, transfer, release, return to owner, euthanasia, or others. So it's basically saying we have to live within our means. And this is why I feel so optimistic about the standards, because I also think that living within our means is the best way of getting rapidly and humanely to 0. And I'm going to show you why. I think all of you have some budget, personally. You have some amount of money that you get every month, and you have some amount that you can spend. What happens if you spend a little more than you earn? Do you get more stuff? Short term, you get more stuff. What happens long term? You get less stuff. The stuff you get costs you more if you spend a little more than you earn, right, over time. And if you spend quite a bit more than you earn over quite a long time, it costs you a whole lot more because you go bankrupt and all your stuff gets taken away. And if you want the most possible stuff for your dollar, you got to get good deals, right? So for a shelter, finding a home for an animal is earning income. Letting an animal in the door is buying stuff. Letting the animal in the door in excess of the number you placed yesterday, so if you placed 10 yesterday and you let 12 in today, that's buying on credit. And if you don't end up finding them homes when you thought you would, that's not paying your credit card bill on time. The way to get the most stuff or to save the most lives is to admit the number of animals that you can place and find them homes rapidly and keep them healthy. That's the cheapest way to do it. Keeping animals healthy and finding them homes quickly. And the way to keep animals healthy and find them homes quickly is to not admit them in excess of the number that you can place. Or if you do admit them in excess of the number that you can release alive at any one time, to make conscious decisions about euthanasia, and for each euthanasia to minimize the time to outcome. So not to euthanize animals that otherwise would have been euthanized, but for those euthanizations that you will perform, to perform them quickly so that both the harm to the animal is minimized and the cost to the organization is minimized. So that is why I think the standards for care really can help us to also achieve a goal of getting to zero. Because if you have to provide, if you set as a goal for yourself to provide the standards for care, it can keep you from spending really more than you earn. Does that make sense? Sometimes you really don't have the resources to sort of maximize your life-saving potential. You don't have enough housing units, you don't have enough foster homes, you don't have enough hours of foster care or volunteer or staff time available to you. And if you don't know exactly what that difference is, it may feel like you can't ever make it up. It's just like if you don't know exactly what the difference is between your income and your spending, you might just feel doomed to, like, you're always going to have to spend on your credit card and your life is just going to be a rolling disaster. But if you found out that you were spending just $20 more a month than you were earning, you could solve that problem somehow, right? If you just knew what the difference was. You could, babysit one time a week or have a bake sale or just cut your expenses by a little bit if you have a known target to go for. And I think with animals, and especially with cats these days, feels like the gap is so huge that we're never going to make it, and so we don't even look at it. But oftentimes, it's not as big as we might think, because it's not over time there's 4,000 more cats than we know what to do with. At any one time, the difference might really be quite small. So this graph is from a shelter that we work with, and it was just looking at what was the required number of humane housing units that they needed versus what they had. And for a humane housing unit, we actually defined it as a half of what they already thought they had, because really their housing units needed to be joined together and doubled up to provide for the standards of care. So they had about 30 housing units that were humane, and at their very peak, they needed 45. 50% more than what they had. Being 50% over capacity meant doubling up and giving cats half as much space as they needed, and sometimes mixing litter mates. And it felt like a total disaster, and cats got sick because of it. And then they actually needed more housing units. And so it felt like they were way, way beyond capacity. But in fact, when they knew they just needed 15 more humane housing units, that seemed doable. Rather than going on forever being $20 over budget and all the credit calls and hassles that entailed, just solving that problem one time really could be done. So find out what you have and what you really need. And if you have less than what you need, think about whether you can't solve that problem. Too many animals is as bad as too few. Too much capacity. If you have room for 400 animals, and really the perfect number for you to have would be 100, solving that problem also can be a really important part of maximizing your life-saving capacity. If 100 animals is the number that allows you to do the most possible adoptions and move them through in a quarter of the time that they would move through if you had 400 animals, and at a quarter of the cost, freeing up 75% of your resources for spay, neuter, and behavioral outreach and the prevention that's really going to solve the problem in the long run, then bring your capacity down to 100 animals, not by euthanizing 300, but by moving them through more quickly until you're at your ideal capacity and then staying there. Remembering that it's about having animals flow through efficiently and humanely, not about holding animals as a way to try and solve the problem of overpopulation. That's going to really serve your organization best. So we know that, we know this, right? The best way to reduce capacity, to improve capacity over time is to improve community capacity and to reduce the need. And this is from the San Francisco SPCA's website, and they're one of the communities in the United States that has the lowest euthanasia rate, and this is some of their programs: is targeted spay-neuter, behavioral counseling to keep animals in their homes, obedience training, affordable care, education, pet matchmaking, accessible housing, all stuff that has been talked about today. All of that takes time and resources, and you'll have the most time and resources if you have healthy animals moving through quickly and safely spending a minimal amount of time in your care. If you don't have capacity today, what can you do? Can you keep not meeting the standards? Can you keep just providing inadequate care? It's what we've done in a lot of shelters for a long time, but really it decreases our capacity, because if we don't provide adequate care, the animal gets sick or develops a stress-related behavior disorder. It ends up taking longer and taking more money to get it out alive. So continuing to accept inadequate capacity is really not an acceptable solution. Increasing capacity will work as long as it also increases your ability to find live release options. Otherwise, it'll just increase the number of animals you're holding without increasing the number that can flow through. Euthanizing more animals, even if that was a palatable option, it won't work unless it was to decrease the time to the outcome for that animal. If you can find a live release outcome in 2 weeks instead of a euthanasia outcome in 2 weeks, that's more efficient. It's actually more cost-effective as well as more humane. So the only real option for increasing or for balancing your capacity today is, moving animals through by keeping them healthy, increasing your capacity as much as you need to do that, and then if you can't fit an animal today, to defer intake today, to find another alternative, to ask the person to hold on to the animal, to redirect it to another organization, to find another solution. And I know that there are organizations here who don't have the option, who are required by contract or by law to take in every animal that comes to them, but recognize that sheltering beyond your capacity still is not going to solve that problem. If you're taking in more animals that you're going to be able to release alive, then you will end up euthanizing the difference. That is not about euthanizing more animals. It's just about moving them through as quickly as possible so that you, over time, euthanize fewer. This is pictures from the Toronto Humane Society now. They've doubled their cat cages, so every cat has double space. They've put in some group housing rooms that are nicely enriched and have no more cats than they're really supposed to do. They've got behavioral training programs for their dogs, so it's really looking a whole lot better there. And here's the logic behind the standards. Good care means healthier animals. Healthier animals in better conditions means more adoptions and less illness, which means reduced sheltering costs. Reduced sheltering costs means more resources for prevention. More resources for prevention means fewer animals needing sheltering in the first place. That means better care for each animal. And good care means healthier animals. So I really believe this is the straightest path to zero. And I might have a little bit of time left. Do I? I do? Would you like to see a case study of implementation? I've got some really cute ones. So I've got one on monitoring and feeding time for dogs in a group house setting. It's kind of a crazy shelter. It's a big, gritty, urban shelter in Florida. I've got one on reducing length of stay and shelter cats, and I've got one that I think that some of you might have seen on Tuesday on changing the housing for shelter cats. Votes, shout it out. Length of stay for cats. Can you click on the Animal Rescue League of Boston? Possibly it's the first one, so if you just progress to the next slide, we might be all right. All right. And go ahead and click to the next slide. Sorry, all right, now I'm in control again. So this is from the shelter standards. Population management, capacity to provide humane care has limits for every organization, just as it does in private homes. Effective population management requires a plan for intentionally managing each animal's stay that takes into consideration the organization's ability to provide care. Poor cat housing is one of the greatest shortcomings observed in shelters and has a substantially negative impact on health and well-being. Primary enclosures must provide sufficient space to allow each animal, regardless of species, to make normal postural adjustments. Turn, stand, sit, stretch, move their head without touching the top of the enclosure, lie in a comfortable position with limbs extended, move about, and assume a comfortable posture for feeding, drinking, urinating, and defecating. And this was the shelter where I showed you the cat that couldn't quite raise its tail. So they did have some challenges with cage size. Length of stay has a dramatic effect on the experience and needs of animals in shelter care. The type of care and enrichment provided to shelter animals must be appropriate to the length of stay. Average or median length of stay also is a key factor contributing to the number of animals present in the shelter each day, which in turn affects the ability to provide adequate care. Even short-term housing must meet the minimal behavioral needs of animals. So, here's the shelter. For the United States, it's a medium-sized shelter, about 2,300 cats per year, a mix of stray and owned, built in the 50s, so about a 60-year-old facility, not a boutique environment. It's a kind of a nice way of putting it. 10 full-time shelter staff, including a veterinarian and a veterinary nurse. High stress levels for cats. It felt crowded. There was a long length of stay for cats. There was more cats in adoption than were being adopted, and there was cats backed up in holding areas just waiting to get onto the adoption floor. They were committed to maintaining the same intake. They were an open-door shelter, and it was unacceptable to have any increase in euthanasia in order to meet the standards of care. So here's just an example of a cat that's not very happy in its little cage, trying to hide under its bed. And as they implemented these changes, they did so gradually, and they carefully monitored their data to make sure that there wasn't either a reduction in intake or any increase in euthanasia. So they evaluated their data. They looked at what was their ideal daily capacity, how many cats should they have in the shelter, and what outcomes were they aiming for. Didn't make any drastic changes. They implemented just feline rounds, so every day they looked at every cat and said, why are you still here? And do you have what you need to move through the shelter today? They put together a foster parent on-deck system. So using just Google Documents, they created a web-based system so that foster parents knew when they were next in line for a litter. So instead of coming in and staying for even a day or two or three, a litter would come in and go out to foster care the same day, and that shaved precious days off for young kittens that otherwise could get sick while they were in the shelter and then end up spending a lot longer in foster care. And that's one of the ways we reduce the capacity of our foster system. If cats end up being sick in foster care, it reduces the amount of litters that can be cared for by our given number of foster homes. And they implemented something called Fasttrack for cats. And they waited until those things were working and had reduced their daily population before they made any changes to their cat housing. They didn't have money to increase the number of housing units that they had for cats, so they had to use what they had. So this is their foster on-deck system. So it wasn't a very complex system. They recruited foster parents proactively, and they let them know who's up next. And they had a goal of getting out a litter a day. So they knew that that's what they were aiming for, so that's how many foster parents they recruited. So most kittens now leave for foster care in 1 to 2 days with a goal of even less than that. And then Fasttrack just can be thought of as sort of like a shelter within a shelter, where the most highly adoptable cats and kittens are prioritized to move swiftly through the shelter, and if there's a lot of disease or a lot of stress, they kind of get to bypass all of that. And it might sound like that's unfair for the other cats that aren't fast-tracked, but trust me, it works out best for everybody, and I'll show you. Kittens were considered fast-track all year round. They knew that if they could keep kittens from getting sick, they could almost always move them out and have them adopted within just a few days of hitting the adoption floor. So they started it by not keeping space, especially in adoption, but they ended up having some space set aside in adoption for fast-track kittens. And then during the slower months in the wintertime, healthy young adult cats also were fast-tracked. So it might vary by shelter which cats are fast-tracked. It might be something you know about a preferred breed or behavior of cats or a look of cats. And the same would apply for dogs. It just depends on what your shelter finds easy to adopt. And they just implemented that by timing of the veterinary exam and by desexing surgery. And so it used to be that they just go in line by the ones that came in the longest ago were up next to move up to adoption and have their veterinarian examine their desexing surgery. And what happened is that instead, fast-track cats always skip to the head of the line. So if an adult cat that wasn't fast-track had been waiting for 10 days, kitten came in, it bumped the adult cat, went to the head of the line, went up for adoption. And here's what they said. We used to pick pretty much by date of intake. Now any fast-track cats get priority in their exams. We designate whether a cat is fast or slow-track on the move-up board. Any fast-track cats should always be moved up prior to slow-track cats. Slow-track cats aren't actually waiting any longer than they were before for their exams, as the whole process of prioritizing fast-track cats expedites things. So this was their results in their cat care day totals by month. And the blue line is the year after they implemented this system. The red and green lines are the year before. And so you can see this is the peak of kitten season for us. And at that time, there was no reduction in length of stay for slow-track cats. That's the solid lines. But for the rest of the year, there was actually a reduction in length of stay for adult cats and also a reduction in length of stay for kittens for most of the year. What that amounted to was a reduction in over 10,000 care days over the course of the year, and that was over a 25% reduction in the number of cats present each day, just by changing their management system. So that has a huge impact to have 25% fewer. Say you were all at 10% over capacity before, and now you're at 15% under capacity. That creates empty cages where if an animal is suspect for ringworm, you have a place to move it to. And it also created the possibility to join two cages together so that the slow-track cats that did have to stay longer were staying at least in an environment where they had a little bit more room to move around and it was more comfortable for them. They admitted 179 more cats during this time period, so their intake didn't go down, but they also adopted 182 more cats, so their euthanasia didn't go up. Then they had fiberglass cages, so it was a little bit of an ordeal for them to figure out how to put holes in them. And it cost them about $250 per cage to do this, but this can be done for much less using PVC portal or various other methods that Dr. Wagner can tell you about. We're the cat housing portal advocates of the world. So this is just a picture of a cage that they were able to modify so that here some kittens are taking advantage of it, but also an adult cat that had to stay a little bit longer really could appreciate having that. So that is Fasttrack at Boston Animal Rescue League. Questions about that? Are we done with presentation time? All right, she's on her way to give me the hook. Questions about the standards in general? Do we have time for a couple of questions?
We do.
Okay,
yes.
Great.
Would you like me to direct that?
Yes, sure.
Would you like to, do you want to stay there or do you want to sit down?
I'll sit.
Sit? Okay. All right. Would anybody like to ask a question? Tim?
Kate, I was just interested, particularly with that last slide, if you're encouraging larger spaces for cats, say, for example, doubling up kennels, if cats have been there for a sufficient amount of time to settle, do you then, as you've done there, perhaps double up cats so that they're both able to utilise that space? I presume if you've got double the space as what you used to have, it's not a big deal for two cats who are happy to be together to both enjoy that space?
No. So that's a great question. We do advocate doubling space for adult cats. It's convenient for kittens, too, just because it's easier to clean and care for them, and they appreciate the additional space and the separation between their litter box and their food and water. But adult cats who don't know each other really need space in order to maintain that social relationship. And if you think about the way that we advise adopters to allow a new cat to acclimate to another cat, we don't say, lock them in your bathtub and let them work it out. Really, cats, even when they know each other and like each other, utilize space in order to negotiate their social relationships. So we wouldn't recommend putting anything other than a bonded pair of adult cats together in a space that small. Sorry. One of the reasons that it works to create those double cages is because by reducing the density and the number of cats sort of waiting in line for adoption, it means that cats just move through the shelter rapidly, naturally, because the line to get sort of to the front of the line to get adopted isn't as long. And so it needs to work by reducing the length of stay for cats and improving the health for cats, and that's the way you can kind of get away with oftentimes reducing the number of cages and the number of housing spots that you have for cats without any increase in euthanasia and without having to reduce your intake.
Any more questions? Okay. Well, it looks like we've done for day 2.